So all of this episode was back sometime fairly early in 2011, I think. So I left the Manuka Health Centre on the advice of a friend, and I joined William Crawford's practice. He was an anthroposophical doctor. Um, that wasn't my major motivation. It was really getting someone to listen to me. So I was going to William Crawford first at the Anthroposophical Centre, which was next door to the Pretoria Street Medical Centre. I don't know for how long. Um, William was very, very good, but he divided his practice between uh, here, Lower Hutt, and Canada, Vancouver. So he'd often be away. But at some stage, he shifted his practice from there to the medical centre, which entailed the transfer of my files from the medical centre where he was registered to the Pretoria Centre, and well, the files that came from the Manuka Health Centre, a lot of them were already the electronic files were already corrupted, and then what was supposed to come through from the other centre, it just finally went missing. So anyway, I had that time, 2011 through to 2014, and I'll take up the story from then, from when um, William Crawford went back to Canada for an entire year. So at some stage, Dr. Crawford went back to Canada, and he didn't come back for over a year. So I had to rely on this medical practice, which I absolutely hated, and I had to go to locums. So the first episode, and there are two parts to this, I'm going to refer to the first episode with Dr. Julie. I don't remember her other name. She does practice I always thought that she was a locum, but she in fact does work for the centre. So I had two consultations with this Dr. Julie in approximately November 2014. They were long consultations in which I tried to explain, with the help of my partner Pam, the seriousness of my conditions. She told me she had looked through my files without having noticed, seemingly, the large gap in the file, and that I'd been diagnosed with sarcoidosis, and did not refer me on for any tests, except for the most kind of routine and meaningless of blood tests. So her contribution, rather than going through my file and going through with me, it was to query whether I had considered the psychological or the emotional aspects of the case, and she referred me to an online survey which was clearly designed to prove to me that I was depressed. So based on this considered diagnosis, I determined that I would not return to the practice while Dr. Crawford was absent. There was absolutely no reason for me to do that. Instead, when there were symptoms of concern, I went to the accident and emergency department of the hospital. So I got at some stage, it was a ring. It was kind of like a summons from the chief doctor, Eric Kussel. And then when I disregarded that, there was a second that was really like a summons to discuss some blood results. And then I went to see him in May 2015 approximately. So based on a quite reasonable assumption that there might be something quite concerning that had come out in blood tests, I booked in for an appointment, which is something which I didn't want to do. And it just turned out that he just wanted to discuss the general aspects of the case. And I remember him saying, I said what I wanted was someone who was honest. And he said, well, if you want honesty, I'm your man. I'm Mr. Honest. He did show quite a lot of interest and did some physical examinations and referred me for routine blood tests while seeming to shrug off my partner's strong desire to have other tests, such as an MRI, done. He noticed that I was suffering from gum disease and was concerned that I was overweight. Obese was the word he used, and prescribed a consultation with the hospital dentist, as well as putting me on a diet based on completely cutting out sugars and carbohydrates. And he seemed to be deaf to my contention based on my long experience that both conditions were secondary to a deeper condition, and promised me that if I followed the diet I would feel at least 50% better. So the diet led to an immediate loss of weight and to precisely zero improvement in my well-being. In fact, my well-being further declined during this period, and I put on some weight over the months between appointments. Somewhat at the insistence of Pam, who was alarmed at the decline in my condition when we went back to see Kusel, whose diagnosis, when told about my lack of sleep, was sleep apnea. So he told me, without the benefit of any tests of anything, that was what I had. You have sleep apnea. And presumably that followed on by his decision that I was dangerously obese. So when challenged on this, he referred me to a list of symptoms on a website, even though this form of diagnosis, etc. Yeah. So when Pam voiced her concerns and gave her own observations, this was countered with medicine needs to be evidence-based. So never mind the evidence-based bit about sleep apnea and the rest. Of course, as a practitioner, he didn't need that. He did a So after 4 or 5 years of being told that there's nothing wrong, being fobbed off, told I was depressed, told that I was overweight, told that I had sleep apnea, and that if I just did these simple things I would feel 50% better, my real doctor in a meeting observed something in my facial expression and referred to me to the neurology department of Wellington Hospital. And right from the start, I have to say that they have been almost the polar opposite of both the Manuka Health Centre and the Pretoria Medical Centre. They've taken me seriously. They've done all the tests. They've done very, very long and comprehensive sessions with me. They've not, up till now, been able to find a diagnosis. They've been seeing me approximately once a year. And I've always said that I don't mind the fact that they can't successfully diagnose or treat my condition. It may well be untreatable. But what I was looking for was some respect to at least be taken seriously and have things discussed with me. So I've had that in the past few years, and a couple of years ago I was sent for psychological testing by a doctor there at the hospital, which showed that there had been some sort of decline in memory function. And of course, I had a follow-up treatment just a few days ago, and that's where we are today. And that's what allows me to say exactly what I think of some of the people who have been treating me over the years. People who, in my mind, are in one case no better than a narcissist, and in all of their cases just incompetence and beneath contempt. That's my feeling now, and I always felt that one day I'd have a diagnosis that would be acceptable to people out there, because so long as these practitioners are telling you that there's nothing wrong, then all your friends, everyone out there are going to come to the same conclusion. So now they can't do so anymore. And consequently, conclusions had been reached that were both upsetting and stressful to me without any reference to my medical history. In fact, they were fucking bullshit conclusions. Rather than responding with, "I'm sorry," or even "I'm sorry you feel this way," the response was was testy and justifying his own attitude and actions. And when I mentioned that I was considering a complaint to the Health and Disability Commission, the immediate response was, "What can I do to induce you not to take this course of action?" In fact, I can recall the actual words right to this very day. And this was followed by an offer of a free treatment, something that I took to be a bribe. And then when I showed him an item from my file, a report on my sarcoidosis from the hospital, the response was, "Oh, yes, I have this. It's a good report." So what was he talking about when he was talking to Pam? He was totally taken surprised by the sarcoidosis diagnosis. So this confirmed to me my fear that my concerns were overridden and decisions were made by two separate doctors at this practice without having referred to essential parts of my medical history. When I went to pay for the session, Dr. Kusel rushed out and he said he had a special scheme to help people who had difficulty paying, or something like that. I don't remember exactly what he said now. But the upshot was he repeated his offer of a free treatment. So I just responded. I didn't know what to do, and I said, "Well, I won't look a gift horse in the mouth." Yeah, I wish to jump several months. William Crawford came back from his extended trip overseas. In the time that he was back, I didn't see him more than one or two times. But the last time was about my sleep. Right through this, I've had stiffness and soreness in my hip, which has given me problems, and it was particularly bad at this time, and I was finding it very, very difficult to get any sleep. So I went back to see my doctor and we discussed it, and right at the end of the session, I could see that he was really reluctant but I said that I would like to try a sleeping pill because I just needed to get some sleep. And very reluctantly, he prescribed me something to try, and that wasn't long before he went overseas again. And it corresponded with the time when I got a new bed that was supposed to be more comfortable, but despite the new bed and the despite the new bed and and the sleeping tablets, I still couldn't sleep. I still had the same problem. So I decided to go back to see the doctor, and of course I couldn't go and see my own doctor. So I was offered an appointment to see Dr. Forsey. Now that was the same Dr. Julie that I had seen several months before, and had very kindly told me that I was depressed, and that there was basically nothing wrong with me. But I thought, well, this is just about sleep. It's just about getting my medications right. So I mean, anybody will do. Any doctor. I mean, surely they can work out my sleep. So I agreed, and I went to an appointment with Dr. Forsey. And as usual, with especially with locums, he sort of said, "Oh, what can I do for you?" And I started to explain my sleep problem and basically what I wanted. And then she started sort of going through the notes and going through recent blood tests, all with the aim of demonstrating to me that everything was normal. She just sort of said, "Oh, your liver levels are just sort of slightly elevated and everything." And of course, I responded immediately. I just said, "Well, you're not my doctor. I'll discuss this with William Crawford when he gets back." And instead of having a reasonable response to that, she just said nothing, and she walked out the room, leaving me there with no explanation. And after a good few minutes, she came back and she said, "Oh, what do you want?" And so I told her. And then she very sort of testily went through a list of different sleeping medications, as if it was just a kind of a decision, a consumer's decision, there's this and there's this and there's this. And then she finished with antihistamines. And by then, that was just it. I just sort of said, "I'm not taking any fucking antihistamines." And of course, what did she do? She walked out a second time and came back in the room, this time with the practice manager. And yeah, kind of. And then the practice manager said, "Would you like an appointment with somebody else?" And I declined for reasons that would be obvious if you've listened for the last 20 minutes to half an hour. And that was that. So I decided to make a complaint and sent a letter to the head of the practice, which is a Dr. McCabe, who I'd seen on one or two occasions. He wasn't exactly that brilliant either. And so I will just follow up by reading the interaction between Dr. McCabe and myself, because when he came back, he sort of came back with the response of Dr. McCabe, sort of implying that it was all down to me, and would I like a meeting, and should Dr. Forsey come? And no way, I was going to bloody had Dr. Forsey there. Anyway, I will now share with you that exchange, during which time my practice largely consisted of often successfully treating refugees from the medical system who fell between the cracks. Throughout that time, although I often encountered difficult patients, I made a point of listening to people and trying to get the bottom of what was ailing them. I would never have and never have treated anyone in anything like the way that I encountered. What I encountered was, in my mind, abusive and an attempt to exercise power given to her by the state, which she attempts to exercise by turning a vulnerable and unwell patient into someone who was, quote, unquote, behaving badly. Considering that there was never any threat to her safety as opposed to her ego, I cannot imagine a worse situation of the patient-doctor relationship in which she, not I, exercises all the power. Since I have been practicing, since I have previously had an experience with her that has kept me waking up from sleep and rage, I have had no time to think of this carefully. Because this stands in such contrast to the relationship of trust I have with Dr. Crawford, this has been extremely upsetting to me and plays on my mind, especially given the sensitivity of my case. Unless I receive a satisfactory response and an apology to this in a reasonable length of time, I shall be taking my complaint elsewhere. Yes, there was trouble. And then also my own doctor, William Crawford, was back by this time, and he just listened quietly through the whole thing. So in the end, it was quite amicable. I was able to vent about the whole thing, and I was asked what I wanted, and I said, I think, an apology, which was forthcoming, and then Dr. McCabe gave an invitation that I could see him during those times when William Crawford was away. But there were two good things to have come out of this meeting, and all of the stuff that had happened in the previous kind of 6 to 7 years, all the trauma. So the first good thing was that around this time I was contacted by a friend with a suggestion, and I was able to go onto a natural remedy to help my sleep, which I've been taking since, and is the only thing that has helped me through all of this time. Out of all of the things that they've prescribed me, this is the only thing that has helped me. I mean, it's such a godsend to have a night's sleep. The second thing that was equally significant was that my doctor was observing the whole thing. He didn't really have much to say, but he said afterwards that he had noticed that I had a particular facial gesture that he was worried about, and he was going to refer me to the neurological department of the hospital. And then within several months, I had my first appointment. It was a long appointment. It was, they had some ideas. I mean, they were sort of kind of false leads, but at least it was going somewhere, and they were proper attempts at diagnosing. what I would have expected from any medical practitioner. I mean, if you're not enough of a specialist to know kind of what you're doing, then at least then you refer someone on to someone who can do that. But instead of that, with the exception of my very good friend and doctor, Dr. Crawford, it seemed as though everyone was conspiring to do exactly the opposite. And for that, I hold them in eternal contempt. So, after 4 or 5 years of being told that there's nothing wrong, being fobbed off, told I was depressed, told that I was overweight, told that I had sleep apnea, and that if I just did these simple things I would feel 50% better. My real doctor in a meeting observed something in my facial expression and referred to me to the neurology department of Wellington Hospital. And right from the start, I have to say that they have been almost the polar opposite of both the Manuka Health Centre and the Pretoria Medical Centre. They've taken me seriously. They've done all the tests. They've done very, very long and comprehensive sessions with me. They've not, up till now, been able to find a diagnosis. They've been seeing me approximately once a year. And I've always said that I don't mind the fact that they can't successfully diagnose or treat my condition. It may well be untreatable. But what I was looking for was some respect to at least be taken seriously and have things discussed with me. So I've had that in the past few years, and a couple of years ago I was sent for psychological testing by a doctor there at the hospital, which showed that there had been some sort of decline in memory function. And of course, I had a follow-up treatment just a few days ago, and that's where we are today. And that's what allows me to say exactly what I think of some of the people who have been treating me over the years. People who, in my mind, are, in one case, no better than a narcissist, and in all of their cases, just incompetence and beneath contempt. That's my feeling now, and I always felt that one day I'd have a diagnosis that would be acceptable to people out there, because so long as these practitioners are telling you that there's nothing wrong, then all your friends, everyone out there are going to come to the same conclusion. So now they can't do so anymore. Well, that's my story. I've always had it on my mind to take action based on the idea that that nobody would take anything that I said seriously. But once the medical profession sort of give a diagnosis, then people can start to take it seriously and respond appropriately. But I'm seeing kind of already that people just continue being kind of in a state of denial, and they don't know how to deal with you. Um, it's a very old-fashioned saying, laugh and the whole world laughs with you, cry and you cry on your own. Sympathy is something that's very widespread, and I'm not sure which is more common, sympathy or sociopathy. But I do know that uh, um, that compassion and the like are very, very true. Compassion are very rare, even amongst those that kind of put them forward as a positive idea. So I don't know what I'm going to do with all of this. I'm certainly not going to be kind of keeping quiet just for the sake of putting a complaint into the very corrupt Health and Disability Commissioner. I'm sure that if I was making a complaint about an acupuncturist or a naturopath, that would be upheld straight away. Attacking the system, forget about it. So I'm saying it here as widely as I can, and again, I just hold these people in contempt. And the reason why I know that they're so contemptuous is because I've got another model within the within the conventional medical model, which is diametrically opposed to that and does care and does do its best and doesn't make outrageous kind of assumptions. So the fact that there are two, and I'm not just throwing something at the whole system, tends to indicate to me that I'm right about this. Anyway, I don't know what I'm going to do. I just have very little energy left for following the things that I do, and I'm sure it will be a combination of things. I'll be spending a lot longer just putting my feet up and relaxing, and at the same time, if I see anything that's serious, and I have to say it's really hard to identify kind of what is really significant and not just part of the kind of 24 news cycle just going on and on and on and on. So if I see anything important, of course I won't be able to help myself, and I'll be reporting on that. So I suspect that there will be some changes coming from this latest visit to the hospital. Okay, this is Seymour Rocks reporting from down under.